Dr. David Jernigan is the director for the Center on Alcohol Marketing in Youth. He is also an associate professor at the Johns Hopkins Bloomberg School of Public Health. Dr. Jernigan has written and worked extensively in the field of media advocacy, promoting the strategic usage of mass media to influence public health policy focused on alcohol marketing and advertising. Dr. Jernigan, thank you for joining us.
Sure. Thanks a lot for having me, Art.
Can you start by educating us on your work at the Center on Alcohol Marketing in Youth?
Alcohol marketing affects young people's drinking. We have more and more studies that are showing that the more exposed kids are to alcohol marketing of various kinds, the more likely they are to start drinking, or if they were already drinking, to drink more. Alcohol marketing is primarily governed by the alcohol industry's own self-regulation. With that kind of a setup, somebody needs to be an independent monitor of how well the industry is sticking to what it says it will do. We are that independent monitor. We were set up in 2002 to track back through what the industry does and measure the audiences that see the advertising. Now, a lot of the debate about alcohol advertising is about content. People see an ad, they're upset about it. And that's fine, but it's very difficult to do anything policy-wise about content. So we focus the conversation on placement. Who actually sees the advertising? And we can use data like Nielsen, Arbitron, and so on. We buy the data that presumably the companies are using themselves to figure out what audiences to advertise in front of. And we can show all the places that kids are more likely to see this kind of advertising per capita than adults.
Can you share with us a little bit about your background and what started you in this field?
I first started working on alcohol issues in 1986, and it was completely by coincidence. But I stayed with alcohol because it touches so many parts of people's lives. And as somebody, I'd like to use my life to make the difference that I can make. And working on this issue, I can make a difference in lots of different places. I can make a difference in terms of young people. I've worked globally with the World Health Organization. This is the #3 leading cause of death and disability in the world. If you want to talk about kids, if you want to talk about national development, if you want to talk about economic development in an under-resourced community here in the US, alcohol is going to have a role. And so it's been a really interesting and satisfying area in which to work.
You were chosen to be the keynote speaker at the 2nd Annual Partners in Prevention Conference. Can you share with us a bit on some of your lecture?
So the first thing is we've got a problem. It's a substantial problem. It's the #1 drug problem among kids. We've made some progress with the kids in high school. We're not making the progress we want to make with kids across the board. So we've got a problem. Why aren't we making the progress we want to make? Because we're not doing the things that the research base says are going to be most effective. And one of those things is we're not doing enough to counter the influence of and reduce the exposure to alcohol marketing. So that's the start. Then I report on the research that shows that the marketing actually does affect kids' decisions about drinking. And then I report on our studies that find, for instance, that about 20% of TV ads are placed on programming that kids are more likely to be watching than adults. That kids are more likely in magazines to have seen, that kids have seen more ads for beer and for Alcopops in magazines than adults 21 and above. And by kids, I mean 12 to 20. That's the age group that we focus on. In radio, the industry has some voluntary standards. They, in 2009, they said, you know, we won't advertise any place where people under 21 are more than 30% of the viewing, reading, or listening audience. We found 1 out of 11 radio ads were placed in violation of that standard. And we found that about 1/3 of the ads were on programming that kids, again, the 12 to 20 age group, were more likely to be listening to than adults of the legal purchase age.
Dr. Jernigan, can you speak on what the impact digital media plays in regard to alcohol advertising?
The situation in digital media from our perspective, it's like the Wild Wild West without a sheriff. There really is nobody minding the store. It's all about self-regulation. There's so much activity, and it flies so easily beneath adult radar, beneath parental radar, and frankly, beneath government regulator radar. And so we have a lively conversation going with the Federal Trade Commission and with state attorneys general around how can the regulators get more engaged here, be more aware of what the industry is doing, be more active so that it's not just left up to the industry itself to police itself, which from our perspective has been a total failure.
What can be learned from the litigation which forced regulations placed on the tobacco industry's advertising and applied to the alcohol industry?
On tobacco, we made tremendous progress as a result of litigation. There have been some efforts on the alcohol side in that direction. What I'm much more hopeful about on the alcohol side is the activity of state attorneys general. They were crucial on tobacco, and they've been quite active on alcohol in doing things as simple as saying to the alcohol companies, look, do as well as tobacco. Tobacco took their ads out of magazines that were going to schools and libraries. You should do the same. The alcohol companies did that. They've gone beyond that to be very active in the conversation about caffeinated alcoholic beverages and really were very helpful in getting rid of caffeine and other stimulants in alcoholic beverages. Now they're very active on the packaging. We've got these supersized Alco-Pops or the binge in a can like Four Loko and Juice and so on. And the attorneys general and the Federal Trade Commission are both pushing on those manufacturers to repackage those and to put serving sizes on them, because right now they're presenting the alcohol equivalent of 4 to 5 beers as a single serving.
Dr. Jernigan, from your perspective, how do we best challenge and resolve this negative social issue?
We will never be able to match the money that the industry has, the lobbying weight that the industry has in state capitals at the federal level and so on. What we've got on our side is numbers. And really, at the end of the day, this is an organizing challenge. And it's an organizing challenge that is going to have to go beyond the preventionists. It's going to have to go beyond even parents. It's going to have to move into an awareness in industry, for instance, that our entire country is suffering from the Monday morning effect, where our productivity is marred by the number of people who are coming in very unproductive on Monday morning. That our future is being compromised to the degree to which we're not successfully reducing the incredible amount of abusive drinking that's happened on college campuses. These are supposedly the bright leaders of tomorrow, and yet we are losing a substantial number of them. We lose 1,800 college kids a year because they die from alcohol-related causes, and countless others have their study careers hurt, suffer physical injury, suffer sexual violence, and long-term effects that we're barely beginning to count because of this epidemic of alcohol use on college campuses. The point here is that we need a much larger public conversation about that, and what's going to drive that conversation is people. We've got to have the people to match the industry's dollars.